Incontinence in women is a major problem. One type of incontinence is called stress incontinence, and usually childbirth can cause that, or just age. That's leaking with coughing, laughing, lifting things, sneezing, or other activities that put stress, pressure on the bladder. The women lack the outlet pressure anymore, so it just leak out to varying degrees. It may be mild. It may be a lot more significant and life-altering, where we do have to do something about it. We have treatments for stress incontinence. Typically, most involve surgery, and there's several different aspects of the surgery we have to talk about and determine if they're a candidate. Another type of incontinence is called urgency, or urge incontinence, or overactive bladder. Typically, we do need to evaluate the woman and make sure she's emptying her bladder, look at her pelvic anatomy, talk to her about her urinary symptoms, make sure there's no infections. If we determine that that is her primary significant incontinence, typically we start with medicines. And to varying degrees, there's lots of different medications. Some of them do have side effects, so we like to monitor those. And if those aren't working, or the medicines are causing too many side effects, there is different treatments, either injections into the bladder, or a bladder pacemaker, or other treatments that we can offer if the urgency and overactive bladder is refractory to the medication. There's also other types of incontinence. One of them would be overflow incontinence, where the woman just has too full a bladder. That may be because her bladder doesn't work very well. That may be because of medications. That may be because of pelvic anatomy. And we're able to determine that and try to figure out a plan and a course of action, because ultimately the goal in treating female incontinence is to improve their life with less side effects. We're a one-stop shop for female incontinence because we can do everything. We can evaluate, we can do bladder scans in the office, check urinalyses, do pelvic exams, and then we have the full range of treatments also, including medications, surgical treatments, and urodynamics, which is special testing to help us evaluate further difficult cases. As a female, some women don't think you come to a urologist for incontinence, but we're the main incontinence doctors and always have been. Some other specialties dabble in that, but we provide full service and we see a lot of success.